my name's Danelle. I'm first aid. What happened here?
I was riding and my hand started to feel a little numb and I fell.
You fell?
Yeah.
Okay. Did you hear any noises when you fell at all?
No.
No? Do you have any pain or any numbness or tingling anywhere?
A little numbness in my hand,
A little numbness in your hand. Okay. Do you feel okay to get up and so we can assess you on the side here?
Yeah.
Yeah, okay. So what we're going to do, I'm just going to grab some ice. We're going to put some ice on that. And then I'm just going to get you to come off. So I'm just going to grab some ice right now, all right?
All right.
What's going on?
I can't do it, Coach.
You're failing for our country. Get back on that bike.
It's numb, Coach. I can't.
Getting on my last nerve. Okay, Brayden, so it looks like you have some symptoms right now of ulnar neuropathy. So that's obviously numbness and tingling in your hand due from compression. However, I can't accurately diagnose that because I do not have the power to do so. However, we're going to refer you to your doctor to go check that out, okay? My suggestion right now for you is just to put some ice on that area and not to put any compression because that's more than likely of how you occurred the numbness in your hand. So yeah, we'll get you to the doctor and we'll see what they say, okay?
All right, thank you.
Perfect, thank you.
Ulnar neuropathy is a compression injury of the ulnar nerve, which runs along the medial aspect of the arm and innervates the fifth and part of the fourth digit. In the wrist, the ulnar nerve crosses between the hook of the hamate and pisiform and then passes through the Guyon canal. The superficial branch supplies the overlying palmaris brevis and then becomes entirely sensory to supply the hypothecate eminence and the ring and small fingers. The compression of the nerve can occur at either the elbow or the wrist. Continuous undue pressure at the elbow or wrist causes the nerve to become inflamed, which in turn causes paresthesia and numbness in the fingers. Ulnar neuropathy of the wrist is referred to as cyclist's palsy. Cyclists are prone to this injury due to applying too much continuous pressure on the medial aspect of the wrist when leaning into drop handlebars for extended periods of time. Severity of ulnar neuropathy follows a three-step grading system. Grade 1 involves mild symptoms such as intermittent paresthesia, minor hypoesthesia of the dorsal and palmar surfaces of the fifth and medial aspect of fourth digits with no motor changes present. Grade 2 involves moderate and persistent symptoms such as paresthesia, hypoesthesia of the dorsal and palmar surfaces of the fifth and medial aspect of fourth digits, mild weakness of ulnar innervated muscles, as well as early signs of muscular atrophy. Grade 3 involves severe symptoms, including paresthesia, obvious loss of sensation of the dorsal and palmar surfaces of the fifth and medial aspect of the fourth digits, and significant functional and motor impairment. There will also be muscle atrophy of the hand intrinsics, as well as possible digit clawing of the fourth and fifth digits. This clawing of the digits results in a sign of benediction. Ways of preventing ulnar neuropathy are minimal. Methods of prevention include wearing cushioned gloves, frequently switching hand positions while riding, using different handlebars, and improving trunk stability and posture, as well as following proper bike setup. A few exercises that can help with trunk stability include planks, ball crunches, as well as back extensions. Proper bike posture should look something like this. Having your core engaged, your shoulders retracted, an extended back, and a forward tilted pelvis decreases weight bearing in the hands, which decreases the compression on your ulnar nerve, helping to prevent ulnar neuropathy.
When setting your
your bike, the first thing that you should consider is the frame size. For this particular person who is 5'5", she has chosen an extra small frame, or it may vary on a different type of brand of bikes. The second thing you should consider is the seat height. Okay, when you pedal downwards, your leg should be at a slight bend, but not fully extended. The next thing you can look at is the handlebars. All handlebars can move up and down, and then also your seat can move back and forth to compensate for the distance between the handlebars and the seat. In the end, your elbow should have a slight bend in it, and your back should have a 45-degree angle. Done.
Thank you for listening. Now we will gladly answer any questions.